Hello guys, this is Indian Medico, and in this video we are going to discuss about radiation retinopathy. The causes of radiation retinopathy include plaque brachytherapy of intraocular tumors and external beam irradiation of sinus, orbital or nasopharyngeal malignancies. Radiation retinopathy is characterized by delayed retinal microvascular changes with endothelial cell loss, capillary occlusion and microaneurysm formation. Radiation retinopathy is associated with cataract and radiation keratopathy. This picture shows a case of radiation keratopathy. The interval between radiation exposure and development of radiation retinopathy is variable and it is usually between 6 months to 3 years. Radiation retinopathy has a direct relationship with the radiation dose. Coming to the signs of radiation retinopathy, fundus examination will show capillary occlusion with development of telangiectasias and microaneurysms. There can be retinal edema, exudate, cottonwool spots and hemorrhages. This picture shows a case of radiation retinopathy with microvascular abnormalities, cottonwool spots and retinal hemorrhages. This picture shows a case of radiation retinopathy with severe macular involvement. The changes of radiation retinopathy are best seen on fundus fluorescein angiography. This picture shows a case of radiation retinopathy in which fundus fluorescein angiography demonstrates aneurysmal and telangiectatic lesions associated with retinal capillary non-perfusion and leakage along with exudation. This picture shows fundus fluorescein angiography of radiation retinopathy demonstrating severe retinal capillary non-perfusion and microvascular abnormalities. There can be proliferative retinopathy. This picture shows a case of proliferative radiation retinopathy depicting neovascularization of disc and arterial occlusion associated with microvascular abnormalities and hemorrhages. There can be radiation papillopathy. This picture shows a case of papillopathy and cottonwool spots following treatment of a choroidal melanoma. Some cases can have radiation optic neuropathy. However, this is less common because the optic nerve is less sensitive than retinal vessels. Coming to the treatment of radiation retinopathy, the treatment is usually unsatisfactory. The treatment options include laser in the form of pan-retinal photocoagulation or focal macular laser. We can give steroids in the form of intravitreal triamcinolone. We can also give intravitreal anti-VEGF agents. The poor prognostic features in case of radiation retinopathy include papillopathy and proliferative retinopathy. Such cases can have vitreous hemorrhage and tractional retinal detachment which require pars plana vitrectomy. Thank you.